Do you know someone who does drugs? If that question brought to mind needles or hand-rolled cigarettes, maybe you're on the wrong track. In 2003, about 15 million Americans reported using a prescription drug for non-medical reasons at least once during the year. With the recent passing of Hollywood icons as a result of prescription drug abuse, we need to take a cold, hard look at what it means to misuse or abuse drugs. Prescription drug abuse is the use of medication in ways not intended by the prescribing physician. Painkillers, sedatives, and stimulants are the most common drugs that are misused. Because prescription drugs don't carry the same stigma as illegal street drugs, many don't realize that they can be just as addicting and just as deadly. Prescription drug abuse is widespread and not confined to any one segment of the population. Studies show that about 15 million Americans report using prescription drugs for non-medical reasons at least once a year. About half of new users in 2002 were female. Teens and early 20s were at especially high risk for misuse. In a national household survey on drug abuse from 2003, 4% of youth, ages 12 to 17, reported non-medical use of prescription drugs in the past month. According to a 2007 survey by the National Institute on Drug Abuse, prescription drug abuse occurred in more than 15% of high school seniors. And they may not be buying them on the street. Do you have a drawer where you keep old prescription medications or leftover drugs? Perhaps your doctor has prescribed medication to help keep some painkillers on hand for when that old football injury flares up. But do you know how many is in the bottle? Would you notice if one or two were missing? If you keep prescription medication in your household that could be misused, what can you do to protect your loved ones from abusing drugs? Most prescriptions are written for people in true need. It's when they fall into the hands of others that the abuse occurs. If you take a drug that was not prescribed for you, it's no safer than taking an illicit street drug. To prevent the misuse or abuse of prescription medications, keep drugs in a locked cabinet. Dispose of any unused pills. If the medication is in a liquid form, such as a cough suppressant, mix it with coffee grounds or kitty litter and dispose of it in the trash. This includes medications that you may have bought over the counter, such as cough medicine, sleep aids, or cold and allergy medication. How can you tell if a loved one may have dependence or addiction issues? Signs vary depending on the type of medication they are misusing. Symptoms may include physical issues such as drowsiness, weight loss, or an irregular heartbeat, or mental impairment such as confusion, irritability, or the inability to sleep. If you or a loved one are having issues with prescription medication misuse, seek counseling from a healthcare provider. Your healthcare provider can perform blood and urine testing to determine whether drugs are an issue. Seek care from one healthcare source who can carefully track all medications prescribed to limit negative interactions between medications. And be aware that combining alcohol or some forms of medications with prescription drugs, especially sedatives and tranquilizers, is especially dangerous. This potentially deadly combination can slow your heart rate and respiration. Prescription medications are drugs. Used properly, they can improve your health. If you are misusing medications, speak with your healthcare professional today.